Which of the following methods is the most precise, universally useful technique for enumerating infective virus particles? A. Electron microscopy hemagglutination. B. POC assay. C. Plaque or focal assay. D. Quantal assay. E. None of these. The answer is C. Plaque or focal assay. The keys to this question are the terms universally useful and infective. Some of the described methods lead to the counting of both viable and non-viable particles, as described below. The plaque assay is the most precise measure of infectivity. The basis of this technique is the formation of clear zones, plaques or foci, in a monolayer of host cells. Serial dilutions of the virus are added to a monolayer of cells known to be infected by the cells. For example, MDCK cells are used for influenza. Most commonly after the virus has been allowed to adsorbone to the cells, an agar overlay is added to prevent dispersion of the virus. This ensures that each plaque represents only a single initial virus particle. For viruses which only infect contiguous cells without releasing virions into the surrounding medium, the agar may be replaced by a liquid. A 21-year-old woman developed low-grade fever, sore throat, malaise, and fatigue that lasted several days. Physical examination revealed swollen lymph nodes and discomfort in the left upper quadrant of the abdomen. Examination of peripheral blood smear revealed 50% of atypical lymphocytes of the total white cells. Result for heterophile antibody test was positive. What is the most probable cause of infection? A. Respiratory syncytial virus. B. Cytomegalovirus. C. Influenza virus. D. Epstein-Barr virus. E. Varicella-Zoster virus. The answer is D. Epstein-Barr virus. Epstein-Barr virus and cytomegalovirus elicit a large T-cell response, resulting in a mononucleosis-like syndrome. Ebv infection is subclinical and milder in children than adolescents or adults. Ebv initiates infection in the epithelial cells of the oropharynx and then spreads to the B lymphocytes in lymphatic tissue and blood. Classical lymphocytosis is associated with the activation and proliferation of suppressor T cells, and it leads to infectious mononucleosis. The atypical lymphocyte, also known as Downey cells, increases in peripheral blood during the second week of infection. Major T-cell response causes swollen lymph glands, spleen, and liver. Fever, malaise, fatigue, pharyngitis, lymphadenopathy, and hepatosplenomegaly are the classical symptoms associated with infectious mononucleosis. An epidemiologist studies virology data including the names of virus families and the nature of the genome. Which of the following families contain RNA viruses? A. Herpes viridae. B. Parvoviridae. C. Poxviridae. D. Reoviridae. E. Adenoviridae. The answer is D. Reoviridae. Except for the Reoviridae, which contains the orbiviruses, rotaviruses, and reoviruses, all of the families mentioned are DNA viruses. The Parvoviridae and Adenoviridae families contain the parvovirus and adenovirus, respectively. The viruses in both of these families have a naked virion, that is, without an envelope, but viruses in the former family have a complex nucleocapsid structure, while those in the latter family have an icosahedral nucleocapsid symmetry. The herpes simplex virus, cytomegalovirus, varicella-zoster virus, and the Epstein-Barr virus all belong to the herpes viridae family. The family of poxviridae contains complex viruses with a naked virion, such as the vaccinia, smallpox, and variola viruses. An epidemiologist at a school of public health of a major medical school examined data from several studies performed by microbiologists. The data set included information about the nature of the etiological agent, virus, rickettsia, chlamydia, viroid, the nature of the genome, DNA or RNA, and whether the agent is obligate intracellular or parasitic. The epidemiologist wishes to determine which features pertain to each disease agent. Which of the following properties is unique to viruses alone? Which of the following properties is unique to viruses alone? A. Obligate intracellular. B. Extracellular. C. Presence of DNA genome. D. Parasitic. E. Presence of an RNA genome. The answer is E. Presence of an RNA genome. Rickettsia, chlamydia, prions, and viroids can be distinguished from viruses, but not by just one of the mentioned criteria. While all of these groups are obligate intracellular organisms, only the viruses are parasites with an absolute intracellular requirement, which also depend on the machinery of the host cell for replication. Prions are small infectious protein particles. Viroids are subviral infectious nucleic acids, which lack even the protein capsid found in viruses. Viruses may contain a genome of DNA or RNA, so the presence of an RNA genome is indicative of a virus, but the presence of a DNA genome is not. Which of the following is an enveloped RNA virus from the family Flaviviridae and is the major cause of post-transfusion hepatitis? A. Hepatitis B virus. B. Hepatitis D virus. C. Hepatitis C virus. D. Hepatitis C virus. E. Hepatitis A virus. The answer is C. Hepatitis C virus. Hepatitis C is an enveloped icosahedral RNA virus with gene order characteristic of the family Flaviviridae. The genome of hepatitis C is infectious and consists of a linear single-stranded 9.5 kilobits molecule of RNA. The virus replicates in the cytoplasm. Hepatitis C is transmitted by parenteral and sexual routes. It is the most common cause of post-transfusion hepatitis. Hepatitis C is associated with acute infection, chronic liver disease, and cirrhosis. Hepatitis C viral infection may serve as a predisposing factor in primary hepatocellular carcinoma. Which of the following clinical conditions is associated with Coxsackie virus type A? A. Herpangina. B. Hepatocellular carcinoma. C. Smallpox. D. Gingivostomatitis. E. Cervical cancer. The answer is A. Herpangina. Coxsackie virus type A and Coxsackie virus type B are members of the P. Cornaviridae family. Coxsackie virus type A is associated with herpangina, which is commonly seen in children. Herpangina is a severe febrile pharyngitis characterized by vesicles or nodules primarily on the soft palate. The majority of cervical cancers, approximately 90%, contain human papillomavirus DNA, usually of type 16 or 18. A researcher specializing in systematics of viruses tabulates data from several epidemiological studies. The data she receives include the names of the individual viruses, the families to which they belong, the type of genome, presence of an envelope, the morphology of the virion, and which viruses are related to each other. Which of the following families contains the influenza virus? A. P. Cornaviridae. B. Coronaviridae. C. Orthomyxoviridae. D. Rhabdoviridae. E. Parmyxoviridae. The answer is C. Orthomyxoviridae. All of the families mentioned are RNA viruses. The P. Cornaviridae family contains viruses that lack an envelope and are icosahedral, rather than helical, in morphology. The P. Cornaviridae family contains enterovirus, cardiovirus, and rhinovirus. The Orthomyxoviridae family contains the influenza virus, while the Paramyxoviridae family contains the para-influenza virus. The Rhabdoviridae and Coronaviridae families contain the rabies virus and coronaviruses, respectively. A 1-year-old boy presents with barking cough and inspiratory stridor. What virus is the probable causative agent of the infant's illness? A. Parainfluenza virus. B. Influenza A. C. Rhinovirus. D. Respiratory syncytial virus, RSV. E. Adenovirus. The answer is A. Parainfluenza virus. The child has the characteristic symptoms of laryngotracheobronchitis, commonly known as croup. All of the listed viruses can cause respiratory tract infections in infants and young children, each producing different clinical manifestations. Parainfluenza virus is the most common agent of croup. Types 1 and 2 are particularly associated with this disease. Croup is characterized by respiratory obstruction due to swelling of the larynx and related structures. Infection may spread deeper to the lower trachea and bronchi, culminating in pneumonia and bronchitis. The infection is seen mostly in 6 to 18-month-old children. How is the recombination of RNA segments from two different influenza virus strains described? A. Peptidoglycan. B. Antigenic drift. C. Antigenic shift. D. Teichoic acids. E. Prions. The answer is C. Antigenic shift. Antigenic shift and antigenic drift can be found in the influenza virus. Antigenic shift is a process by which two or more different types of influenza A combine to form a virus radically different from the ancestor strains. Antigenic shift occurs in two ways. 1. Antigenic shift can occur through genetic recombination, or reassortment, when two or more different influenza A viruses infect the same host cell and combine their genetic material. 2. An influenza A virus can jump from one type of organism, usually a bird, to another type of organism, such as a human, without undergoing major genetic change. A point mutation that leads to an amino acid change and altered antigenic sites so that the virus is no longer recognized by the host immune system is called antigenic drift. Peptidoglycan and teichoic acids are components of the bacterial cell wall and prions are infectious protein particles. A patient has all the gastrointestinal symptoms of infection with hepatitis A virus, HAV, yet all the tests for HAV-IgG and HAV-IgM are negative. Laboratory diagnosis reveals A. Positive, RNA virus. Which of the following is the most probable diagnosis? A. Rhinovirus. B. Hepatitis C. C. Hepatitis C. D. Yellow fever. E. Rotavirus. The answer is C. Hepatitis C. Hepatitis C virus is a naked, strand, ssRNA virus. It has clinical and biochemical features that are very similar to hepatitis A, except that it seems to be more severe in pregnant women. Therefore, hepatitis C is the virus that is most likely the cause of disease in this case, if serology indicated the absence of hepatitis A. The other choices are incorrect. Hepatitis C is enveloped and does not cause gastrointestinal symptoms. Rhinovirus causes common cold. Rotavirus does not present with jaundice as do hepatitis-causing viruses. Last, yellow fever can be associated with hepatitis, but it is a lot more severe in presentation than hepatitis A and is transmitted by mosquitoes, not fecal-orally.